Welcome, everyone. We're so pleased that you could join us today for supporting Georgia's early care and learning system with COVID-19 relief funding. I'm Theresa Derek Mills, and I'll be your Urban Institute host today. And I'll be joined by Urban Institute colleagues and executives from Georgia's Department of Early Care and Learning. Next slide. First, we want to just start off with some housekeeping. We want to make sure that you know that this webinar is being recorded and all participants are muted. Please feel free to share with us any questions or comments in the Q&A at any time. We will answer some of those questions periodically during the session, like typing back to you. And we will have time at the end of the session where we address some of the questions then. Tomorrow, the recording and slides, study report, and executive summary will be posted online. Links will be emailed to webinar participants and registrants tomorrow when they're ready. We also want to note that we have closed captioning turned on. If you'd like to adjust your settings, then you should click the live transcription button at the bottom of your screen. And if you're posting thoughts on social media today, please use hashtag #live@urban to connect your posts together. Next slide. So today our focus will be on learning more about Georgia's early care and learning system and some work that Urban Institute did for Georgia's Department of Early Care and Learning. We'll start today by setting the context for our discussion with an overview of that system. Then we'll learn about how Georgia was using its COVID-19 relief funding at the time that it contracted with the Urban Institute to engage Georgia's early care and learning stakeholders. Next, we'll provide an overview of Urban Institute's stakeholder engagement and study recommendations. Basically a preview of the release of the report tomorrow. Obviously, we can only touch on a few things in this webinar. And then finally, we will learn about Georgia's next steps in strengthening their early care and education system to address the report findings and recommendations. Next slide. So if I could ask all the speakers to turn on their cameras as I introduce them today. So today we have 3 members of our Urban Institute research team and study authors joining us. As I said, I'm Theresa Derek Mills. I'm a principal research associate and have worked at the Urban Institute for about 11 years, but I've been working on and studying early care and education systems for more than 25 years. I led the study that we will talk about today. I'm joined by Carrie Liu, who co-led our effort to gather perspectives from early childhood educators and operators and DECAL staff, and by Diane Schilder, who co-led engagement with families. We had a much larger research team, but these are the folks representing the team today. We're thankful to many other team members and the people across Georgia who participated in the study. We're also joined by 2 Georgia Department of Early Care and Learning executives, Amy Jacobs, the commissioner. She was appointed to lead the department in 2014, and Bentley Ponder, the deputy commissioner for quality innovations and partnerships. He has worked at DECAL in various roles for more than 15 years. We appreciate them partnering with us to learn more about stakeholder perspectives and needs. And now we'd like to take a moment to get to know our audience just a little bit more. We're going to have a poll for you to participate in. We hope you'll let us know what perspectives are represented today in the webinar. So first, if you could tell us who's listening, pick the role that best matches your interest today, and where are you listening from? We'd love to hear from you. we'll just pause a moment here on the poll. Thank you. Yeah, let's take a look and see what folks have said. Oh, it's so great to see. We've got more than half of the folks that are joining us are early childhood educators. And we've got other system staff, a few researchers, and wow, it's great to see 95% of the folks listening in are from Georgia. Thank you so much to everybody for joining us today. We really appreciate it. Right, next slide. I'm going to turn this over to Bentley Ponder, Deputy Commissioner.
Thanks, Theresa, and really excited to be here. After you did the introductions, I started getting some texts from some colleagues from both Georgia and across the country that were saying they were on the webinar. So that's always great to see. And I'm just really excited to be here. I think everyone's going to appreciate the rigor that went into the research that Urban Institute did. And I think you're really going to be excited about some of the projects that Commissioner Jacobs will be talking about in just a few minutes. So next slide, please. Since Theresa, you mentioned 95% of our audience was from Georgia, so I won't go into too much detail on this slide. In case anyone, it hasn't been mentioned or not sure, so DECAL stands for the Department of Early Care and Learning. We are one of a few states that has a distinct early education department, meaning that we are separate from DOE, from our Department of Education. We're separate from other departments where traditionally some of these programs have fallen, and we are our own independent agency / department. We have over 750 staff, and this slide gives you an idea of some of the programs that we have at DECAL. So we have our nationally renowned Georgia's Pre-K program. We also have our Child Care Services Division, which is responsible for licensing and regulation of child care in Georgia. One of the programs that's in my division is Quality Rated, our Quality Rating and Improvement System, 10 years old this year. Very excited about that. We also administer our Child Care and Parent Services, which is our CAPS program, nutrition services. So for those familiar, CACFP and Summer Food Program. Georgia, we also have our Head Start Collaboration Office, and I'm not looking to see the participants, but if Allison Sutherland is on, she is our Head Start Collaboration Office Director, and always excited for that work. We also have an Early Head Start Child Care Partnership Grant, which is also part of this division. We have our Instructional Supports Division, which includes inclusion and behavior support services. If you're not familiar with those, I encourage you to go to our website. There's some great information there and some great resources for everyone. And then that division also has our infant and toddler supports, and then just several different quality initiatives that we have here, professional programs. And then we also administer our grants. And just a shout out to our 2Gen innovation grants and grantees, if they're on the call, that we just funded, but that would be an example of that. All right, next slide, please. So Theresa and the research team thought it would be nice if we set some context of what the early care and learning system looks like in Georgia. So just some geographical notes. We are 159 counties. So that's a lot of counties. There are different ways to parse out the metro Atlanta area. traditionally or generally we think of it as a 29 county area that, even though we think of Metro Atlanta as being urban, actually includes 10 rural counties and then 19 urban counties. There are 110 other rural counties in Georgia, and then 20 other counties that would be considered urban. Like for those familiar with the state, like Savannah and Macon would be examples there. Currently, and as of June 22nd, we have 3,121 child care learning centers and 1,234 family child care learning homes. In our CAPS program, there are 35,533 families receiving subsidies, and that encompasses 65,342 children that have an active scholarship, and that are part of our child care subsidy program. Excited to say that a little bit over 2,800 providers are quality rated, meaning they're 1, 2, or 3 stars. That's close to 2/3 or a little bit less than 2/3 of licensed childcare in Georgia. And then, as I mentioned, our pre-K program, which is celebrating its 30th year upcoming, last year served 73,200 children. So with that, I'm going to turn it over to Commissioner Jacobs. As Theresa mentioned, Commissioner Jacobs has been here since 2014, and I would just say has led the agency through some big expansions, both pre and post-pandemic. It's always an honor for me to present with her. And with that, I'll turn it over to you, Commissioner.
Well, thank you, Bentley, and thank you all for being with us this afternoon. I want to start to just set the stage with some of the federal funding that we have received and get us set with the amount and what we've obligated so far. So if you'll look on the next slide, this shows you exactly what we've received from Congress through some of the COVID relief dollars. These dollars came directly to DECAL as the CCDF agency. We received all 3 funding streams, which were from the CARES Act, the CRRSA Act, and then the American Rescue Plan Act. And as I'm sure you know, these 3 funding sources were really meant to mitigate the negative impact of COVID on the childcare industry. We all know that it was impacted very severely for many different reasons, and it was important to the feds and to us here at DECAL and our state and our governor to make sure that we were able to continue to support families as they went to work and support children in their growth and development by keeping childcare open. And I'll have to say that has happened, and I think there's good news to share in Georgia as we talk about childcare. But we've used these funds so far really in 3 areas or 3 categories. One is to stabilize childcare, so help directly to childcare providers. Also to support families with access to high quality childcare, and to support the early education workforce. And you'll see through the next few slides I talk about, and then the new projects that I get to talk about at the end, that we continue to categorize our funding into those categories. You'll see at the chart on the right, this shows you exactly the amount of money that we received from each funding source. Down at the bottom where you see that total, Georgia received $2.1 billion from these funding sources. And to date, with the projects that we are currently implementing and those we have previously implemented, and then the ones I will talk about at the end, the new projects that we'll be announcing today, we will have obligated $1.9 billion of that total. So we are very close to having 100% of these funds obligated. On the next slide, I want to talk just a little bit about what we've done so far. So beginning very, very early on in the pandemic, our very first project that we funded with these dollars was STABLE, which is called Short-Term Assistance Benefit for Licensed Entities. We have done 1, 2, and 3 rounds, and now we're what we call Stable Forward. On those first 3 rounds of Stable, we sent out $165 million directly to childcare providers to do just that, just what the name of the program is, to stabilize their business so that they can remain open. And we did that in early summer, fall of 2020. So as soon as we got those dollars, we began implementing those stable payments. We did the 3rd round in May of 21, and then our Stable Forward payments began in November of 21, and those will continue on a monthly basis through September of 2023. To date, the obligation of that money is $912 million directly to childcare programs to help stabilize their business. We also have several CAPS initiatives that we implemented with these dollars. One is Access, which is awarding childcare education scholarship supplements. We began that in May of 2021 when we began paying the full tuition for CAPS families. Usually CAPS families pay a family fee, and oftentimes they have to pay the difference between what our CAPS rates pays and what the provider charges. And beginning in May of 2021, recognizing the need, especially to families with low incomes, we decided to temporarily help them by paying their full cost of tuition. We also expanded CAPS. We usually serve 50,000 children. We were able to add 10,000 additional scholarships. And along with that, at the same time, we increased the quality rated bonus payments by 15% per tier. So if you are a 1-star, you now receive a 25% bonus on top of your regular CAPS payment. The 2-star, a 35% bonus, and a 3-star, a 55% bonus to recognize the importance of quality and the cost of quality. And at the same time, any provider that was not yet rated, that they were going through the process, we provide them with a 15% bonus on top of that. Early in the pandemic, we also provided essential services workforce scholarships to those families that may not have otherwise qualified for CAPS, but were considered essential service workers. And then we still have some emergency payment policies in place, like paying for enrollment instead of attendance and paying programs if they were open or closed. We also provided resources to our workforce because we know how valuable they are. And to date, we have provided 3 rounds of what we call POWER, which is providing our workforce essential recognition. And each round was $1,000 to childcare teachers and any staff that work in the building, drive the bus, cook the food. We provided them with 3 rounds of $1,000 each. We just finished up our 3rd round, which totals over $100 million directly to the early childhood workforce. If you'll go to the next slide, I want to share a few more projects. SHARE, which is our school age help and relief effort. We provided $5 million in grants to support providers who are caring for school age children, especially when school was held virtually, but they were still in childcare receiving that virtual school. We also just finished up some teacher supply grants where we were able to provide over 28,000 teachers with $125 to purchase classroom and program supplies. And then we also have allotted and are about to close out a $14 million COVID test and PPE grants program where programs can go in and purchase COVID test kits, PPE, and cleaning supplies. So that is what we are currently doing, either previous or ongoing projects. And I will turn it over to Dr. Bentley Ponder again to talk about our stakeholder engagement with Urban Institute.
Sure, thank you, Commissioner. And next slide, please. So I think as you'll hear in just a few short minutes, we pursued a really intentional and robust stakeholder engagement process, especially after we received that 3rd batch of COVID-19 relief funds. And I don't think I need to go into too much detail about why this was important. I mean, we know this was a historic opportunity. I've been, at DECAL for 15 years and never thought, actually 17 years, and never thought that I would see an opportunity quite like this. But that being said, we all hope and expect that there will be additional investments in early education. But as of now, these funds are temporary. They are one time. So what is the best way that we can, maximize the impact of these funds, but then, minimize what you would say, in the 4th bullet there, those benefit cliffs. We also thought, this was a great opportunity to invest in some long-term systemic changes. So what would be some ways that we could invest these funds, maybe do some pilot programs, see what works best, and then look for some larger changes, down the road. And all of this then resulted that to do those things, to achieve what I talked about and, to recognize what's in those earlier points, we needed input from a representative group of stakeholders. So we wanted to make sure that we had a mechanism for obtaining feedback. We wanted to make sure that it was statewide, that it wasn't just isolated to one particular region or type of county. We wanted to make sure that it represented families, it represented the workforce, it represented our child care centers, it represented our family child care learning homes, it represented school age, and that, it also represented our, amazing stakeholder groups that work really closely with us. So to do that, we know that we needed this formalized intentional approach. And that is why we, began working with urban and were able to, as you'll see in just a second, I think really achieve that. So next slide, please. And so, from this, as we started planning and designing the project with urban, what is it that we wanted from this? What were the outcomes that we expected? Well, we knew that we needed a multi-method approach. So we knew we couldn't just send out, a survey. We also wanted to do focus groups. We also wanted to look at, we have an abundance of administrative data that we can many times only look at a fraction of. We wanted to be able to use that and, again, make sure that we had this wide representation of stakeholders providing input. We wanted to make sure that we ended up with a clear set of recommendations, not just conceptual recommendations, but really clear recommendations that then we could translate and align with tangible, doable projects, especially with those that relate to some of the things that we're already doing and the things that, Commissioner Jacobs mentioned a few minutes ago. This gave us an opportunity to also look at, what does, early education look like, and this research was done, last fall, in fall 2021. I think we all know there's been a lot of changes, pandemic related changes to the system. And so this gave us an opportunity to have that snapshot. It also gave us an opportunity to, think about what is right now, but also think about what could be with this historic opportunity of funds. And then, the research and data is near and dear to my heart. And this gave us an opportunity to look at where we might be able to invest in future research. And I think you'll see that in some of the projects at the end of the presentation. So with that, let's get to the meat of the presentation. Let's hear the research and the research findings. And I'm going to turn that back over to Theresa.
Thanks, Bentley. So in today's presentation, we're going to spend most of our time talking about the 9 recommendations that resulted from the stakeholder engagement that the Urban Institute did. But first, we want to set the stage just a little bit and share our approach to engaging Georgia early care and learning stakeholders, who we engaged and how. Next slide. So we proposed an approach based on our team's history of working in and studying early care and education systems, our understanding of the need to gather information from a wide range of people and circumstances. And we met regularly with a committee of staff who work at DECAL to help us better understand the diversity of places and experiences in Georgia. We gathered perspectives and experiences and recommendations from the people who need the services and who deliver those services. So those fell into 4 key groups: parents, early educators, early learning providers, and DECAL staff. In this presentation, when I say early educators, we're typically talking about the teachers, the folks who work directly with kids in programs. So those could be family child care providers. They could be people who have a variety of titles, but we're calling them early educators here. And when I say early learning providers, I mean the people who operate child care programs. So the folks that tend to be in the positions of like director, again, could be family child care providers, but we want to make sure that folks understand that we talk to people and gathered information from all levels of folks that work in early learning programs. And as Bentley said, with kids ages birth through age 13. And we also talked to DECAL staff. Those staff are on the front lines of delivering the services, and sometimes they really know what some of the biggest challenges are that they're facing as they're trying to help folks get the services that they need. We wanted to assure voices from across the state and from people in vulnerable circumstances were heard. And we wanted to make sure we could provide timely information that DECAL could use to make programmatic and allocation decisions. Next slide. So between October and November of 2021, we gathered more than 7,000 perspectives from across the state. We we were doing this during a pandemic, and we wanted to gather the information in a short period of time to make sure that DECAL could get the information sooner rather than later, and be able to use that. And so we did it through 2 online surveys, one of the early care and education workforce, and one of the DECAL staff. We also conducted 26 focus groups where we talked to 83 Georgia residents who are guardians of children birth through age 13 and 23 people working in early learning programs. For those of you who may not or may not be familiar, a virtual focus group means that we had a meeting kind of like this where, but we had just a handful of people, like maybe about 10, sometimes 5, in a group talking together and answering questions. In the report that we'll put out tomorrow, you'll be able to see Appendix A of that report for much more detailed information about where people were located, but we made sure that we were able to gather information from people in rural and urban areas all across the state. We for the focus groups, we limited some of those specifically for families participating in the CAPS program so that we could ask about their experiences there. We also limited some of the focus groups to certain areas of the state so that we could make sure that all areas of the state had a chance to participate and weren't crowded out by particularly populous areas. DECAL shared with us email lists so that we could reach out directly. They helped to promote us reaching out, and some other groups helped us to advertise participation options. Next slide. And then I'm just going to set the stage for the approach we took to developing the 9 recommendations. We asked people directly when we talked to them through the surveys, what were some of the things that they recommended. We also asked people questions about their experiences and their needs, and we shaped those into recommendations. We focused on what parents, early educators, and operators were telling us and what they were suggesting. And folks had a lot of recommendations and strategies that they thought that DECAL should consider. And so really what we did was shape those into 9 overall recommendations, and then presented back to DECAL what people said. We used our expertise to package the information back, but we really wanted what the folks on the ground said that they needed and wanted and thought DECAL should do to shine through. As we said, we talked to DECAL staff as well, and we used that to help us think through some of the ways to put things together and to discuss what we learned in the report. And I want to say before we get into the specific recommendations that I was really struck by how much the different groups clearly cared about each other in what they shared with us. So when we asked parents about what they need and what they recommended, they didn't just talk about what they needed for themselves and for their children, which certainly they did, but they also said that they really cared about the early care and education educators and providers. They were worried about what kind of stress they were under and the circumstances that they found themselves in to serve the families and the kids. And we heard the same thing from the child care providers about the parents and the children, that they had worries about themselves, but they were really worried about the kids and the parents too. And similarly, the DECAL staff, they indicated that they were working very hard, but that they had they had concerns and worries too. So really everything came together, and it was great to see that folks were thinking about each other in the system. As we share these 9 recommendations, Carrie, Diane, and I will be kind of trading off in the presentation. And so first, I'm going to hand it off to Diane to begin to reveal our recommendations.
Thanks so much, Theresa. So I'm going to present the first 3 recommendations on the next slide. And as Theresa mentioned, there's much more detail in the report that will be available tomorrow. So the first 3 recommendations that came again from the various groups we spoke with are to provide support to encourage more people to become early childhood educators, as well as for individuals who are already early childhood educators to remain in the field. The second is to focus attention on and provide information about basic health and safety in early care and education settings. And the third is to reconsider group sizes and child to staff ratios in ways that support effective interactions. The next slide provides more detail about this, and Carrie is going to take it from there.
So a bit of background on the results that led us to these recommendations. In the workforce survey, we asked early childhood educators about the primary challenges they face working in the field, both before the pandemic and at the time of the survey. So low pay was the most frequently reported challenge in both time periods, selected by nearly 2/3 of respondents. And mental and physical health and inadequate benefits were the next most commonly reported challenges, chosen by 1/4 to 1/3 of respondents. Educators' concerns about physical health also grew from before the start of the pandemic to the time of the survey in fall 2021 due to COVID-19. Next slide, please.
Next slide. Nick, I'm sorry, we're not actually seeing, whoop. All right, looks like we'll be getting the slides again in just a moment.
So as participants are reflecting on the first 3 recommendations and the information that Carrie just presented, we would encourage you to put any questions in the Q&A so that we can, again, respond to any questions or clarifying points that you might have.
I'll just go ahead and continue to share the information about the recommendations, and we'll get our slides back as soon as possible, I'm sure. So the first recommendation around providing support to encourage more people to become and remain early childhood educators. This is something that we heard from parents, early care and learning operators, and child care providers. They all expressed concern about a staffing shortage and about early educators leaving the field. We received suggestions to encourage to improve educator pay, to create more career pipelines that will assist child care programs with finding qualified staff. So in other words, even in the midst of these challenging circumstances, folks were thinking ahead. Like, let's not just solve the problem right now in the moment, but let's think about how can we bring more folks into the field. They suggested things like supporting high school students to do dual enrollment and childcare apprenticeships that offer on-the-job training, coursework, mentorship, and helping to support the folks in childcare programs that were then trying to train new people coming in. They talked about on-the-job learning and overseeing volunteers. And in other words, folks had a variety of suggestions. They also helped wanted to ensure staff members were properly trained. So in other words, even though there's a crisis and there's a need to bring more teachers in, parents and everyone wanted to make sure that those people that were brought in had the right kind of training to provide, to improve child safety, and to assure skills needed to provide the services. Next slide. And thanks, team, for working to get the slides back up. So in terms of the second recommendation, focus attention on and provide information about basic health and safety. Parents did express some concerns about their childcare programs. One of the things that came up during the pandemic was they were not able to go in and see the programs. And so it really came to their mind about wanting DECAL to do more unannounced visits, wanting to be able to see inside the programs. And so they suggested providing funds for cameras that would allow parents and supervisors to see what's going on. And they also wanted more information that was easier to find about inspections and violations and how those had been handled. And then making sure that they had a place to call if their children were injured or disciplined inappropriately in a childcare program. And I'll note that DECAL said that there was a place already that parents could call, but parents saying this was an indication they just needed that information to be provided in a different way. Next slide. And then also to reconsider group sizes and child to staff ratios. Typically what parents said was that they were concerned that their children were not always getting enough attention. And sometimes they would say something like, it seemed to them that their child's diaper had not been changed for a long time, or that the folks that they were interacting with in the childcare programs didn't really understand their child or couldn't tell them about their child's day. And so they were thinking about it this way, that if there were fewer children per teacher, that it would be a way for their child to get more attention. They also expressed concern for the early educators about challenges and stress of caring for so many children. And center-based early childhood educators were more likely to express these concerns than home-based educators. Next slide.
So when they were asked about operational changes or supports that would most help them keep working in the field, the highest shares of educators indicated additional staff, availability of substitute teachers, smaller class sizes would be helpful, with 40 to 55% of all respondents selecting these options on the workforce survey. However, as Theresa mentioned, the supports most commonly reported as helpful varied by program type, with smaller class sizes being cited as helpful more often by educators working in Georgia's pre-K program, additional staff being cited as helpful more often by educators in center-based programs, and higher enrollment or attendance being cited as helpful more often by educators working in a home-based program. Next slide, please.
Great. Now we're going to transition to our next three recommendations. Providing more accessible information to families about available early care and learning services. Consider how to support more providers in offering care, providing longer hours, and participating in CAPS, that's the subsidy program, and supporting providers in taking care of social, emotional, and behavioral needs. Next slide. Diane, I'm sorry, you're on mute.
I'm trying to increase the volume. Can you hear me okay, Theresa?
Yeah.
Terrific. Thank you. And I forgot to hit the button. So specifically, parents suggested that DECAL could improve the information that DECAL is already providing, such as the way that the information is distributed and the language that's used. Specifically, parents recommended increasing accessibility of information by placing placing it in information that parents regularly visit, such as churches, schools, farmers markets, and the like. They also
Diane, I'm sorry, you're breaking up, so I'm gonna take over.
recommended reaching out to expectant and new parents through OBGYN offices. Okay, great.
Great, thank you. So parents asked to get information in some different ways and suggested that it could be helpful to provide. They noted DECAL was providing lots of information, but that it would be helpful to provide it in some different ways and through different types of messaging, and to improve existing information on DECAL sponsored websites. Next slide. Parents noted challenges with care availability. These are two of the many quotes representing what parents had to say, but they wanted to be sure that we knew that it's not just nurses and doctors who have 12-hour shifts. We were all hearing a lot about that in the news at that time, and that many of them also had to work long days and therefore needed longer hours in their childcare programs. They also wanted us to know that often they were looking for care and finding that they had to be on a waiting list. And in this particular case, the parent said that they'd been on the waiting list since her son was born, and now he's a year old. Next slide. And so on this one, the recommendation is to consider how to support more providers in offering care, providing longer hours, and participating in CAPS. Essentially, folks suggested that perhaps there could be incentives to providers to stay open longer, offer care on evenings, weekends, and holidays, and transporting children. Basically, this is what parents were saying were some of the barriers for them to having the kind of care that they needed to support the work that they needed to do. They also suggested supporting providers to increase participation in CAPS, the Child Care Subsidy Program. So as we said, we spoke specifically in some cases to families participating in the subsidy program, and they were looking for additional options for their children. I will say that, they wanted to have programs that were warm, that provided learning opportunities for their kids, and provided quality care. And what they were saying was there just wasn't enough out there to meet all their needs. Next slide. And then finally, in this set of recommendations, parents, early care and learning operators, and early education providers all shared similar concerns. They all noted that the impact of the pandemic, had on kids, and that they felt like they needed some more support to support the needs of those children. Next slide.
So the instructional and classroom support, most frequently cited as helpful by educators, was assistance managing behaviors and supporting social-emotional development, which played into this recommendation. Many also indicated additional classroom materials were support that would help them keep working in the field. But again, responses varied by program type, with educators working in home-based programs, selecting access to curriculum and lesson planning resources more often, and help managing behavior or supporting social emotional development less often compared with educators in other types of programs. Next slide.
Great. So we have two more recommendations. Consider new benchmarks for affordable care in Georgia and CAP's parent contributions, and supporting CAP's program operations to increase responsiveness to parents. Next slide. So for this one, essentially what we heard from parents was that both parents who do and do not receive childcare subsidy support from the CAPS program were saying that it was hard to pay for childcare even before the pandemic. Everybody noted that costs in their lives were going up at this time. And for some folks who were not participating in the subsidy program, they were saying, you know, look, we have to kind of compromise here. We can't be employed in the way that we would like to be if we don't have help in paying for care. And so this particular quote is from a family who said that the wife had to give up her job in law enforcement to stay home with the kids because they couldn't afford the cost of care. Parents receiving CAPS, on the other hand, said that the program changes waiving parent tuition that had been instituted because of the pandemic had been a lifeline. Next slide. And then there was a fair amount of parents talking about their interactions with the CAPS program specifically, and that's what this particular recommendation is about. So when we say CAPS program operations, we mean the delivery of services of the child care subsidy program to the families that need that assistance. And parents and staff both noted that the CAPS program had been serving more people and providing higher levels of support during the pandemic. And so they understood that strain. And at the same time, there were parents that had been participating before the pandemic and during the pandemic who had suggestions about improving communications in ways that they thought would make it easier to access services, provide less burden on the CAPS staff, and improve the service for everyone. So that included providing clear information on the website, more information about why an application is denied, mailing notices sooner, improving training for application reviewers, and understanding parents' constraints during the business day. In other words, it can be really hard for parents to respond to phone calls during the business day, even when they know that it has to do with receiving their services. Next slide.
Need to support CAPS programs, given the strains of the pandemic, and this demand for their services was also evident in the survey. Program operators most frequently selected additional staff, availability of substitute teachers, and higher attendance or enrollment as operational changes or supports that would most help them keep working in the field. And having more teaching or caregiving staff was cited as helpful most often by operators who reported their programs participated in the CAP subsidy program. Next slide, please.
And then the final recommendation is to offer more grants and supports for financial sustainability and business planning. In this case, childcare operators were interested in receiving both the short-term help and relief that they needed now, and to think about the future. So if you think back to what Bentley and Amy were saying in the beginning, that some of these funds are temporary and won't continue into the future, how can we make sure that the child care programs will continue into the future? And providing business supports is one way to help them do that. Next slide.
Again, this was reflected in the workforce survey, where program operators said they most frequently selected additional grants, sustainability planning, and staff professional development opportunities as supports that could help their program if they were to be offered. Again, responses varied by program type, with home-based program operators selecting staff professional development opportunities less often than others, and a relatively high share of Georgia pre-K program operators selecting that as helpful support as well. Next slide.
Now we're going to turn this back to Amy Jacobs, the commissioner, to talk about new initiatives with federal COVID-19 funding. Amy?
Well, thank you, Theresa and your team. So you all had a chance to hear just a brief summary of what we learned from the stakeholder engagement. And now I want to announce our new projects with the remaining dollars we have from these COVID stimulus federal dollars that we received. So on the next slide, I want to start with the projects that support childcare providers directly. I will say, just like I began, we did try to categorize these into supports for providers, the workforce, and for families, but I have to say they all indirectly support each other and support childcare providers. But on this first slide, you will see the direct new projects that will support childcare providers. The first is a provider rate increase for access. Effective October 1st of 2022, a 7.87% increase will be applied to the capped provider rates that were used to calculate the access payments back in May of 2021. In order to get to this increase and to inform this percentage, we forecasted the childcare price growth for the duration of the initial access time period, which was from May 2021 to September 2022, and the extension, which I'll talk about a little bit, through September of 2023. And this is based on the observed market changes in the price of full-day childcare. So this increase, the 7.87% increase, combined with the 15% tier bonus increase for quality rated providers, will mean that the average weekly payment per child will increase by 19.77% since access began in 2021. And this is just to ensure that providers are compensated appropriately for providing high quality childcare. Our next project is health and safety grants. We will award $80 million in grants to childcare learning centers and family childcare learning homes. The grants will range from $5,000 to $40,000 based on capacity. And these will fund things like facility improvements that impact our compliance with our health and safety regulations, injury prevention, and Consumer Product Safety Commission compliance. We also will be awarding Georgia pre-K grants. These will be $5,000 one-time grants to pre-K classrooms to purchase technology, instructional materials, and approved curricula and classroom furniture. Our next project is quality rated restoration grants. So the purpose of these grants is to support providers as they prepare for on-site observations, which we are beginning soon. So these grant funds will be able to be used to purchase materials, equipment, and professional development opportunities for staff. They will also include bonuses for eligible staff after a star rating has been achieved. So these grants will be $5,000 for each classroom and then $500 for each staff person. We also will be providing some ECE business supports. We plan to offer resources and training to childcare providers to strengthen their business practices, support sustainability after the COVID-19 relief funding ends, and of course, always to increase their ability to offer high quality early education services. We'll go to the next slide. I'd like to talk about this projects that will support directly the ECE workforce. The first one is a school age project where we will increase supports to programs offering school age care through grants, training, and coaching opportunities. We also plan to convene an ECE task force to support recruitment and retention of a skilled early care and education workforce. As you've seen with the stakeholder engagement, we don't like to make decisions on our own. Here at DECAL, we really like to involve our stakeholders, so providers, families, and of course, teachers that are actually doing the work. So we plan to convene a task force to get feedback and work together on the recruitment and retention issues that we all know are prevalent in childcare in Georgia and in the nation. We also have a workforce entry program where we will be expanding access to the Child Development Associate, the CDA, which will include adjusting DECAL scholars eligibility criteria. It will also include paying the full cost of the CDA and contracting to offer the Teachstone CDA program for pre-K Head Start and early Head Start, and also partnering with our higher education institutions to explore alternative pathways like on-the-job training and apprenticeships. The next project is strengthening the ECE career pipeline, and we will include, this will include expanding formal education pathways for infant and toddler teachers and awarding innovation grants to develop the ECE career pipeline supports. Last on this slide, you will see Power Up, which is different from the 3 rounds of power that I talked about earlier. Those 3 rounds of power went to anyone that was currently working in the ECE field, in the childcare field, teachers, or any staff. This will be a little bit different. These Power Up funds will be used in conjunction with our existing DECAL Scholars Program to support increased tuition reimbursement rates and to provide a temporary wage supplement while pursuing a credential. If you'll go to the next slide, I'll continue with our supports for the workforce. We also will be doing a mental health consultation pilot. This is to increase support for families in accessing mental health services and for teachers in understanding mental health development and mental health support. So we will fund a cohort of infant and early childhood mental health consultants, and we'll support up to 5 consultation contracts to expand community and family-based mental health supports. We also will be expanding our pyramid model training, which we've been doing for many, many years. With this dollars, we will be able to expand that so that the ECE workforce can develop children's social emotional skills, improve classroom climate, and use trauma responsive practices. So we will provide this training to the ECE workforce with online modules and with support from our DECAL specialist. You are probably familiar with OLLI, which is our online learning library initiative, and we will be expanding OLLI on the professional development system to include training curricula for target audiences, including substitute teachers and new teachers. We know there are a lot of those right now given the workforce issues. We also plan to develop courses for required health and safety orientation, 40-hour director training in ethics and professionalism. We also will be doing another round of teacher supply grants. These will be more of a back to school type grant opportunity where we will provide $125 to ECE professionals to purchase classroom and program supplies as they get ready for back to school. If we go to the next slide, we'll talk about our projects for families. As I mentioned earlier, Access is the program where we pay full tuition for families receiving CAPS. And we originally committed to do that through September of 2022. We will be extending that for these families through September of 2023. And we are happy to do that because we know that all families are struggling with expenses right now, and to take this off their plate is definitely part of what we should be doing at DECAL, and definitely a requirement of the federal dollars that we've received. We also will be starting a CAPS student parent 2-gen pilot. You should know that recently we added an additional priority group for CAPS, which is for student parents. So those parents who are attending school, going back to get a credential or additional degree. And we will be piloting some additional support at 3 Technical College System of Georgia campuses. And our intent is to help these student parents attain their educational and workforce training goals by providing easy access to CAPS, helping them locate and pay for quality childcare, and by delivering more services quickly. We will use a family-centered coaching approach, and the pilot will help student parents connect to resources using Find Help Georgia and to apply for other state services through Georgia Gateway. We go to the next slide on our other projects that fall into the other category. The first is our business partnership grants. And this is really relating to all the feedback we got on non-traditional hours. That's something that we've never done before. So this will be a pilot, which we will pilot with employer child care support program through our business partnership grants for 8 to 10 Georgia businesses that have staff who work non-traditional hours and need childcare. So we will be working very closely with 8 to 10 businesses around the state to help understand their needs for these non-traditional hours, with funding to them to help provide childcare to their staff. We also will be doing additional community transformation grants. We will fund 2 new grants and offer extension grants to our current grantees. These grants are to increase access to early childhood services and resources in local communities by creating early education partnerships among community agencies and other stakeholders. that will design, tailor, and implement projects that address critical local needs. We know a lot of this work happens at the local level, and we're happy to provide this locally based funding so local communities can address the needs directly in their communities. And we'll also be doing 2 research projects. One is a CAPS research project where we will focus on the family perspective. You heard through the stakeholder engagement that that came up. And so we will be looking at 2 distinct groups of CAPS families, families who currently receive CAPS, families who apply for CAPS and are denied, and families that receive CAPS who are denied at their annual renewal. We really want to be able to serve these families as effectively and efficiently as we possibly can. And so we need more from them on their perspective. And then, of course, as you know, this is a lot of money coming to our state that's going directly to support childcare, over $2 billion. And so we need to do a system level evaluation to really evaluate the impacts of this funding and what happens when the funding expires. That is definitely a fear of mine of what happens when this money does expire. We're doing some great things, and childcare is definitely stabilized in Georgia, but we know they still have challenges that I hope that these projects that we talked about will help. But we also want to look at what happens when the funding expires and how do we continue to support the childcare industry in Georgia. Those are all of the projects that I have to announce, and I know now we have time for some Q&A, so I'm going to turn it back to Theresa and Bentley to facilitate that.
Sure. Thank you, Commissioner, and thank you, Theresa. This is great and really exciting to see everything. I mean, to see it all in this one, in this one presentation. It just strikes me the enormity of it. Before we get to questions, I just want to offer a couple of, I would say housekeeping things. So first of all, we've been receiving several questions in the Q&A, especially in this latter section of the new projects. Keep in mind, tomorrow there will be a document posted with the evaluation report and everything that actually provides more information about these projects and provides a timeline. I would also say that many of these projects are also in the infancy stage right now. And so there's still a lot of planning and, operationalizing what these projects, exactly will look like. An example will be these business partnership grants. So this is something that I'm going to be working on with Laura Wagner and my community outreach and partnership team. And there's a lot that we are still working on, and a lot of, details that will be forthcoming. So please be patient. I promise we will get these out to you as soon as possible. We will also take your questions, and again, some of them have been answered directly, and we're going to create an FAQ where we'll be able to offer more, more information on these. So information is coming. This is kind of the first drip of that, and there'll be more over the next, over the next couple of weeks and months. In terms of some of the questions that we've got, and they've really kind of come in these last few minutes, so I'm doing the best I can to make sense of the volume. But some of the quick ones that I can answer first, we had several about quality rated restoration grants. I'm really excited to see people interested in those. These are grants, for those programs that are going to be rated between July 1st of this year and December 31st of next year. Somebody asked, are they going to be available to family child care learning homes? Absolutely. There'll be more information tomorrow in the document. There'll be information about the timeline. And then over the next, month or two, there'll be information about how programs can apply. So really excited to see the questions with that. We also had, and Commissioner, I'm going to answer this, and I think I've got the right information, but we also had some questions about our pre-K classroom grants and whether they were at the program level and the classroom level. It's my understanding they are at the classroom level. And so, that was a pretty easy one to answer. And there's a lot of questions when the Commissioner was talking around our early education task force and mental health consultations. And I know that Susan Adams is our Deputy Commissioner for Instructional Supports in Pre-K. I know she is listening in, and we will be sending those questions to her. Again, there'll be more information forthcoming about those, but I know she'll be excited to see the volume and the interest in those pieces. Kind of shifting gears though, just for a second before we get to, some more of the big picture pieces here. Theresa, we had several questions, as you were going through about some of the methods with the study. And I was struck particularly by, questions asking, were family child care learning homes, how were they included in the study? We had some questions about, the workforce and, sample sizes and basically, how all that was determined. So I know that's a really big tent of questions to ask, but I just wondered if you could elaborate on that just a little bit.
Yeah, sure. I can speak to it some, and then I will definitely point everybody to the materials coming out tomorrow, because we really looked carefully and worked carefully with the DECAL team to make sure that all different kinds of provider voices were represented. We used the Georgia Professional Development Registry as one key source of information for getting email addresses for providers of all kinds. So in other words, we didn't want a scenario where we were just sending an email out to the head of, like, the director of a program or the owner of a program. We wanted to make sure we were reaching directly out to both family child care providers and centers. All types of programs that exist within Georgia. And we did analyze results from a variety of different perspectives. So like I said, we just presented a couple of slides here, given the time constraints. But when we looked at the results, we looked at them by the type of program, we looked at them by the type of position in a program, and we looked at it by all the counties and regions in the state to make sure that there was some participation from all across. So I did see some folks wanting to know, how many people said which thing. You will see that provided in percentages, but what I can say is that more than 6,000 early care and education providers did provide us with feedback. We did ask certain kinds of questions on the surveys that we thought would be most helpful to DECAL and not provide a significant burden. And it is the case that we heard different things from different kinds of providers. And we've highlighted just a couple of things to talk about in the presentation, but if you didn't hear your perspective in the presentation, it doesn't mean that it's not in the report. Does that help?
Yeah, no, I think that's really good. I'm just curious, and I know there's been some questions, around, just sort of the big picture findings. Was there any particular finding or anything that just resonated with you as you went through this and looked through the study and, looked at the data and everything?
Sure. I think for me, and I mentioned this, that part of what I was struck by was how much people cared about each other, and that when we asked parents about what they needed or wanted, that they didn't just talk about what they needed or wanted, they talked about what they thought DECAL should do to support the child care providers as well. I think, I was struck by folks, focusing not just on the present, but on the future. And I felt like we had a lot of very thoughtful perspectives provided in the conversations and in the surveys.
I agree. I mean, for me, a lot of it, as I look at the findings, it's a lot about access. So, access to higher quality. How do we ensure that? Families need, or asking for more access, but it's also access to other services, and also looking at the way that we, have information that's out there for families. So I know that for me, as I think through with Quality Rated and some of the other work that we're doing, somebody asked about where do I get more information about 2Gen innovation grants? Thrilled to hear the question. what are ways that we can really make sure that that information is getting out there? And so the things that we are doing to expand access to other services is known too. So no, definitely, it was really nice to read a lot of the findings and just to see the myriad of perspectives that were included in that. Commissioner, we did have some questions just asking, kind of what our process was with this. It's really important for us that we have stakeholder engagement and, and that we look at data. And I think, the best way to explain it is, we received earlier drafts of the report, as is typical in these types of studies. I think it was, 1 or 2 months ago, we all met as a team. We looked at these things. We looked at the report recommendation by recommendation, and then we thought, okay, what would have the greatest impact on the provider, level? What would, in terms of, workforce with, teachers and directors, and as you said earlier, everybody that works in the program, what in terms of families, in terms of the system at large. And from that, then we developed a list of potential projects. Then we all went back and we kind of costed them out, and we looked at the feasibility and how this aligns with our other projects. And then this is where then we ended up with what I think is a very comprehensive list, and that now we're in the process of operationalizing and, moving these projects forward. I just want to verify that I know that.
Yeah, I could not have said that better, Bentley. But just to reiterate, we did take everything we received from Urban from the stakeholder engagement and sat in a room and really came up with, a list of projects that we hoped addressed those concerns that were brought up in the stakeholder engagement feedback. Also, we had to make sure we were meeting the federal requirements of these dollars, which I do believe that we are. We checked that really closely with our CCDF administrators. But this is a lot of money and a lot of projects. And so we had to make sure we had the manpower and the bandwidth and the ability to administer these projects. And so I know that everyone is eager to know more about every single one of these projects, because I know they are ecstatic about them. And we will be sending out more information and timelines. There'll be a document on our website tomorrow that will show you more about the timelines of when these will be implemented. And we'll be sending you more information. A lot of questions, Bentley, about, how do we get on this task force, and what about these mental health consultations, and how do we be a part of that? So that's exciting that people are eager, and we will let you know. So we won't be making those decisions behind closed doors here in Atlanta. We will absolutely let you know, but I ask for your patience and your grace as we implement all these projects, and make sure we do it really, really well. But you will be included just like you were included today. And so, and I'll answer the easy question. Yes, we will be posting all of this on our website, and I know Urban will be sending it out to all the participants. So you will have the full report. You will have all of our slides. You will have a summary document with more timelines and a little bit more information. And there's still more information to come as we implement, which I believe are 19 projects that I announced today. So more to come, Bentley.
Yes. I'm so glad, somebody listed a question, what's our next step? What do we do next as a community? And I would say, read the document, share the word, and have a little bit of grace and patience as we incorporate 19 new projects into our existing day-to-day work. And with that, Theresa, I know we're at 4:12, so I will turn it back to you.
Great. Thanks so much, Bentley. Team, could we have the last slide, please? Great. Thank you all so much for attending. We know that you have very busy days and schedules, and we appreciate you spending the time with us. If you have questions about this study, you can email me, Theresa Derrick Mills, at tderrickmills@urban.org. If you have questions about any of the DECAL programs and services, please email bftsresearch@decal.ga.gov. DECAL's Research and Policy Analysis team will answer or forward any of your questions to the appropriate program. Please take a minute to complete our poll before you leave. And tomorrow, if you attended this or registered for this workshop, then you will receive links to the webinar, the slides, the Urban's report, and the executive summary. And I'm sure DECAL will be emailing out to folks all the information about all of their new programs that they announced. Bentley, did you want to say anything more about that?
No, I would just, I mean, people I know are probably wondering where that email address came from. So, back in the day, we referred to ourselves more as Bright from the Start versus DECAL. So it's Bright from the Start research at decal.ga.gov. And again, thanks, Theresa. It has been, I'll just say it's been a pleasure working with you on this report. And I look forward to our future collaborations with both you and the team.
Same from our end, Bentley. Thank you so much. We really appreciate all the thoughtful time that DECAL staff spent with us, getting ready for and reflecting on the information. And it's really great to see it used. I did want to say, somebody said in the notes or in the questions, that it feels like what we said in this report was maybe not different than what they were thinking was going on in Georgia, or that they've heard in other places. And the goal here was to be reflective of what is going on and from all over Georgia. And so if you didn't hear something different, then actually that's a good sign that that we're reflecting what it is that you believe to be going on in your communities. So thank you so much. We appreciate everybody's time. Take good care.